What is sleep inertia in chronic fatigue syndrome? Have you ever woken up feeling more tired than when you went to bed? This feeling is known as sleep inertia, and it can be particularly challenging for individuals with chronic fatigue syndrome. Sleep inertia refers to a period of impaired alertness and cognitive performance right after waking up. It is characterized by feelings of grogginess, confusion, and a struggle to fully wake up. For those with chronic fatigue syndrome, this experience can be even more intense and prolonged. In chronic fatigue syndrome, sleep inertia often manifests as a severe difficulty transitioning from sleep to wakefulness. Even after what seems like a full night of sleep, individuals may wake up feeling exhausted and mentally foggy. This is not just a simple case of waking up on the wrong side of the bed. It is a complex symptom tied to the overall experience of fatigue in this condition. People with chronic fatigue syndrome frequently deal with various sleep disturbances. These can include unrefreshing sleep, insomnia, or hypersomnia, which is excessive sleeping. When they wake up, they might feel stiff or fatigued rather than refreshed. This sensation can be considered a form of sleep inertia, but it is often accompanied by other symptoms typical of chronic fatigue syndrome, such as post-exertional malaise, which is a worsening of fatigue after physical or mental activity, and cognitive impairments often referred to as brain fog. Key features of sleep inertia in chronic fatigue syndrome include waking up feeling exhausted or stiff, struggling to achieve full mental alertness, and experiencing non-restorative sleep that does not alleviate fatigue. Additionally, sleep disturbances like insomnia or fragmented sleep can worsen sleep quality, contributing to the feelings of sleep inertia. Cognitive impairments or brain fog can persist right after waking, making it even harder to start the day. Unlike conditions like idiopathic hypersomnia, where sleep inertia is a defining symptom, in chronic fatigue syndrome, sleep inertia is part of a broader pattern of sleep disruption and fatigue. Pain and other symptoms common in chronic fatigue syndrome can interfere with sleep quality, further exacerbating the feeling of sleep inertia. Understanding sleep inertia in chronic fatigue syndrome is crucial because it plays a significant role in the overall fatigue and cognitive difficulties experienced by individuals. Managing sleep quality and addressing factors like pain and sleep fragmentation may help reduce the severity of sleep inertia symptoms. However, these issues are complex and requiring individualized medical care. In summary, sleep inertia in chronic fatigue syndrome involves significant difficulty waking up and achieving mental alertness, often accompanied by unrefreshing and disturbed sleep. This exacerbates the pervasive fatigue and cognitive dysfunction characteristic of the condition. If you or someone you know is dealing with these symptoms, it is essential to consult a healthcare professional for personalized advice and support.